In this video, we will introduce the Pediatric Assessment Triangle. This tool was developed by the American Academy of Pediatrics and allows us to make a doorway assessment that can quickly identify our sickest kids so that we can move to provide them excellent, necessary, and fast care that we need to give to them. The three sides of the Pediatric Assessment Triangle are appearance, work of breathing, and circulation to the skin. These should be assessed before even approaching the child, and as mentioned, should be assessed from the doorway or the car door or wherever you're first encountering the child. Let's start with general appearance. In order to assess the general appearance, assess the muscle tone and movement of the kid. Look for any listlessness or limpness. A kid that's in a situation that 911 is involved in probably should be freaking out. Pay attention to whether or not the child is interacting appropriately with their environment. Look at their gaze. Do they track people appropriately for their age, or do they have the look of nobody's home in their eyes? Watch for the parent's ability to console the child if they're upset and see what the rest of their body is doing. Are they flailing about or sitting very still, or are they limp? Next, assess the work of breathing. This too can be something that's done from a ways away. If you can see the patient, you should immediately start listening. Listen for abnormal airway sounds such as stridor, grunting, or wheezing, all sounds that sometimes you can hear without a stethoscope. Also, look at the patient and how they are breathing. Are they using their intercostal muscles? Are they using their abdominal muscles? Does it look like it's hard for them to breathe? Look for nasal flaring, intercostal retractions, or belly breathing. Finally, assess the circulation to the skin. Just by evaluating the patient with your eyes, you can look for pallor, mottling, or cyanosis. The ability to assess this will vary depending on the skin tone of the child, but you can still evaluate for changes from afar. You will use this not only to assess your patient in the Pediatric Assessment Triangle, but also will use this information and combine it with other factors to determine how sick your patient is. For example, pale skin on any patient combined with tachycardia represents compensated shock. Mottling can be an ominous or late sign. Cyanosis can be a sign of respiratory distress or congenital heart defects. The skin of your patient can tell you a lot of information about their overall status of health. As you learned in Mastering Medicine in Adults, if the body needs more blood to go to the core, the skin is the first organ to lose blood flow, resulting in the dangerous findings that we just discussed. If the three quick assessments above are all reassuring, you can slow down, take your time, and gather a full, detailed history. However, if any of them are positive for concerns, you may need to act quickly, take a brief, focused history, and begin interventions. So how do we interpret the pediatric triangle? It depends on which sides of the triangle are abnormal. If just the work of breathing is abnormal, this would be considered respiratory distress. However, if both the work of breathing and the circulation or appearance are abnormal, this would be considered respiratory failure. As you can see, the more sides that are abnormal, the more sick your patient is. And all sides should be taken both individually and as a whole to help with your initial pediatric assessment. As mentioned, skin changes may represent shock. So how we apply this to the pediatric assessment triangle? If just the circulation to the skin is abnormal, this is a sign of compensated shock. However, if both the skin and appearance are abnormal, this is a sign of decompensated shock. If all three sides of the pediatric assessment triangle are abnormal, you have a very sick patient. By thinking about this initial and general assessment as a triangle and putting the pieces together, you can get more comfortable assessing pediatric patients and taking some of the guesswork out of the assessment, in addition to turning some of this into type 1 thinking. Now that we understand and can use the pediatric assessment triangle, in the next videos we will build on our doorway assessment to learn more about how we obtain a history and physical exam and what this means for our patients.